you everyone for attending. I think we are somehow 10 to 15 minutes late, but we shall be able to make it. So without taking more time, I would like to invite you to proceed. You are welcome, Doctor.
Thank you. Can everybody hear me?
Yes, they can hear you, but they are currently muted.
All right, thank you. So, well, thank you for opportunity to present, to make this presentation. And I would like to say that I don't have any conflict of interest to declare. And I'm not sure why I was chosen for this presentation, but I thought it might be important so that the audience might at least be able to understand who am I. I'm a doctor of medicine. I graduated from University of Dar es Salaam under MOOCs in 2004, and I did my internship at Bugando Medical Center in 2005. And I did my residency in pediatrics and completed it in 2010. And I'm trained in adult nephrology, which I trained it partly at MOAS, at Christian Medical College, Vellore, India, Auckland University Hospital and Bergen University in Norway. And I've done pediatric nephrology training at University of Cape Town, whereby I was based at Red Cross Children's Hospital. And I'm also trained in pediatric rheumatology, and I completed this training in 2017. This is a program which was jointly hosted by EULA, European League Against Rheumatism, and Pediatric Rheumatology, European Society. I'm a member of Medical Association of Tanzania, Pediatric Association of Tanzania, African Association of Nephrology, International Society of Nephrology, International Pediatric Nephrology Association, and I'm the founding member of Nephrology Society of Tanzania, and I'm also the Secretary General. I am a fellow of Royal College of Physicians, London. I'm also a fellow of International Pediatric Nephrology Association and International Society of Nephrology. So back to the business of the day. I am supposed to talk about pharmacy and the multiple hats of a pharmacist. Of course, I believe that this is a profession that is evolved over a long time, and I understand if people are reading the history of pharmacy, they will recognize that the practice of pharmacy started way early in the Babylonian time, where this act was practiced by the priest, pharmacist, as well as the, who was a medicine man, as well as the physician at that particular time. And these roles were jointly, and there are a lot of involvement in the practice of pharmacy. And of course, the firstly privately owned drugstore was opened in Baghdad, which was in Iraq, and this was around the 8th century. And of course, this practice was eventually exported to other parts of the world, and there was a lot of evolution in the practice of pharmacy, as well as the apotherapy and all these things. So if one is asking me, who is a pharmacist? Of course, the first thing, the talk is all about the pharmacist and the multiple hats that one wears. If you're looking at the competence of the competence that we uphold at Muhimbili University, we'll refer a pharmacist as a competent professional who is offering pharmaceutical services. And this, there are several roles that falls under these roles, including community pharmacy, hospital pharmacy, industrial pharmacy, which also include research and development, drug regulation, procurement, as well as marketing, and a lot of other roles that are embodied in the this profession of pharmacists. But again, if you are asking who is a pharmacist, I mean, he's an important member of the team of healthcare professionals, okay? And when you look at the healthcare professionals, I mean, the idea is to solve the problems. This is what we do. And these problems are really various. They could be medical, social, spiritual, political, personal. And definitely for somebody to be able to solve these problems, This calls for innovation, compassionate, kindness, generosity, as well as gentleness. All these are the attitudes and features that will define a successful pharmacist from my point of view. And when we talk about clinical practice as one aspect of the healthcare provision, I mean, we are talking about multiple specialties. I mean, different people that you are dealing with, they all see things in a very different ways. If you are sitting with surgeons, they are like a different tribe. If you are sitting with pediatricians, they see things completely different. You have nurses, you have different people that you have to deal with, okay? And this practice involves use of multiple molecules. Some of the molecules are very old, some of the molecules are very new, some are cheap, some are expensive, some are available, some are not available, some are registered, some are not registered, and all these have to be handled, okay? And we are dealing at multiple levels. Is it primary care? Is it secondary care? Is it a tertiary care? You know? Is it a private setting? Is it a public setting? Okay, and all these, the pharmacist has, at the same time, this pharmacist has to serve the interest of their institutions, their colleagues and clients. And when I talk about colleagues, that means the people that they're working with. It could be a doctor, it could be a nurse, it could be a laboratory technician, and all these people, they have different interests that have to be met by this particular person. So again, who are these colleagues? When we talk about colleagues of a pharmacist, I mean, these are the colleagues. They could be doctors who, as I said before, they come in different sizes and shapes. And you could even say that they are different tribes. The way they do, the way their cultures are, the way they practice, and what they are looking forward, the anticipated goal, they all see things completely different. You have nurses, you have procurement officers, you have finances and accounts, you know? And they all have different expectations. At the same time, on the background of your, on the background, you have pharmaceutical industries, you know, the marketing departments. You have all these people that are coming in, that interacting with everybody else. So you might have medical representatives that are coming, interacting with the doctors, you know, bringing all the new products every single day, you know. So instead of using captopril, people are supposed to use candesartan. These are the same drugs which might be doing the same work, but some are new, they are more expensive, you know, and somebody wants them to be available immediately, you know. So this is one of the challenges that I see from this pharmacist point of view whenever they have to deliver their services. So if somebody is interested to know what are these roles that a pharmacist has to play, from my perspective, what I would, before I go into these particular roles, I would like to give you two cases which are just showing us the complexities of the services that we are offering. So we have a 7-year-old patient with nephrotic syndrome, okay, who has been prescribed prednisolone on alternate days for 6 weeks, as well as levamisole, which is 8 mg daily for 1 year. Levamisole is a common antiemetic drug. I believe all of you know that. And these drugs come in a very small dose. They come into 40 mg tablets. And somebody is asking you to give these tablets for a supply of 1 year. And this particular patient has to use these drugs for 1 year. So every single time they have to go to a pharmacist, they have to get these drugs. So do we know how these different drugs are being used and what are the indications? And this is one of the challenges that we face as a clinician and as pharmacists as well. Do we stock these drugs? Because in my hospital, this drug is not stocked because they think it is not. I mean, they have better alternatives in the form of albendazole and mebendazole. But this drug is needed for treatment of nephrotic syndrome. The other case is an interesting case. It's a 3-year-old child with anemia, weighing 16 kilograms. The hemoglobin level of this patient is 6.5 grams per deciliter, which is consistent with iron deficiency anemia. And the prescription that was written for this child is syrup Hemovit, 2.5 mils once daily for 3 weeks. This is how this child is treated. So, but if you look at the requirement of this child, this child will need 4 to 6 milligram per kilogram per day of elemental iron. And this should be given daily until normal hemoglobin is attained, which is around 11 grams per deciliter. Then you need to continue giving this medication for 2 to 3 months to replenish the iron stores. So the expected hemoglobin raise is 1 gram per deciliter every 2 weeks, which means, and at the same time, 5 meals of Hemovit will give you around 38 milligram of elemental iron. So in actual sense, what this child will need 64 milligram of elemental iron, which is around close to 7.5 meals, if you're giving 7.5 meals, which it gives you around 57 milligram. And the duration of therapy to reach normal hemoglobin level will be 9 weeks. If you are assuming that in 2 weeks, you raise hemoglobin by 1 gram per deciliter. And you also need to get additional 8 to 12 weeks to replenish the iron store. So this child who has iron deficiency anemia will need 5 months of iron therapy. This is half a year of therapy. But what the clinician wrote on the prescription is 2.5 meals once daily for 3 weeks. And this prescription is sent to the pharmacist. So I'm just trying to show you the kind of patients that we have to deal with, and the communications that we are getting from the colleagues that have to interact and work with the pharmacist. So if I'm looking at the roles of the pharmacist, so the first role that I would like to think about is the bedside roles. Are there roles that a pharmacist can do? When you are looking at the bedside, what happens at the bedside? Of course, it is important that the pharmacist participates in the ward rounds. And when they are participating in the ward rounds, they need to guide the choice of therapeutic molecules in the form of what is available in the particular institutions, what is feasible, what is affordable, and provide an insight about potential interactions, because oftentimes you have drugs that are interacting with each other. You're giving somebody ferrous sulfate, at the same time, you're also giving them omeprazole, which are taken at the same time. And if you're getting them at the same time, they will definitely interfere with the absorption of each drug. And then you're not doing what you're supposed to be doing, okay? Then you also need to sort out double prescription. Sometimes you have patients that is given ferrous sulfate as tablets, and at the same time, it's given folic acid. But if you look at the combination, if you look at the formulations that you have, the ferrous sulfate already contains folic acid. And this particular patient has ferrous sulfate, at the same time, they have folic acid, which is prescribed separately. So that means you're giving this patient a necessary cost and the necessary medications. And sometimes you might also be causing adverse effects. And of course, you have to make sure that the drugs are appropriately prescribed. Okay, the drugs should be given according to what the indications are, which is very, very important, because the clinicians will write the drugs. These are the drugs that I want to write. Are the doses based on the prescribed? Are the doses based on the indications? And I think there's a room for the pharmacists to interact with the clinicians and to let them know, you're prescribing this kind of drug at this particular dosage. This is not enough. This is not adequate. Why are you giving this much? So all these are important interaction. And I think this is one of the important roles that should be played by the pharmacist to guide the prescription of the medications that are provided to the patient. But it is also important that at bedside, the pharmacist should be able to support the administration of therapeutic molecules. We have a lot of molecules that have been given, and some of them really have to be combined, and they come in some of them are not mixed already. Some of them will have more than one chemical to be combined together. And the people that are providing these drugs might not be aware of what is happening. And oftentimes, you have a lot of wastages because these drugs are being combined by somebody who is not an expert in that area, without that guide. And cost effectiveness as well. Can we minimize the wastages? If somebody is getting 1 gram formulation and they need 250 milligram, is it possible to store the remaining one for the next use? But if it is going to be stored, how should it be stored? Okay, what are the environment that are required for the storage participation, for the storage conditions? Also, it is important to teach and mentor. We're talking about junior colleagues, we're talking about non-pharmacy professionals. You have nurses, you have doctors, you have other people that are handling drugs, and they all need to be trained how drugs need to be handled. Okay, do we have a safe and good environment to store our medicines? Are they stored properly? Are they sorted out? I mean, are they based on the expiry date? Are all the emergency medicines available timely whenever they are required? So I think this is what I look at the bedside role. But again, the most important aspect of role of the pharmacist is antimicrobial stewardship. This is something that we really need, particularly in our country. And I think we've been lagging behind in protecting the antibiotics that we do have. And I believe that the pharmacist sits as a very important role to make sure that they are able to guide, to guide and to drive the formation of these policies and guidelines. And this should be driven and should be provided based on the setting of the particular institution. And it is really an important initiative. And for you to be able to have a meaningful stewardship program, you also need to know what kind of antimicrobial are being used, who is using which antimicrobial, and for what reason, for what duration, what is the evidence available, all right? I'm giving a good example. You have surgeons that are doing surgery, and pre-operatively, someone will give ceftriaxone, the other person will give cefotaxime, the other person will give metronidazole, and there will be people that will be giving it for 1 day. There will be people that will be prescribing for 7 days. And this is prophylaxis, okay? And everybody is prescribing based on what they like, you know, based on what they are. You might not even be sure what is the basis for their prescription. So I think it is really important that the pharmacists will stimulate and advise and lobby, precisely lobby, to have audit of the antimicrobial practice. How are you using the antimicrobial practice? If we are all doing cesarean section, why can't we agree that we'll be using ceftriaxone, 1 gram preoperative, and everybody gives that? And if you want to deviate from that, you have to justify why you want to give it for 3 days, if it is prophylaxis, okay? But we also need to make sure that we have surveillance of resistance. It is important, surveillance of resistance is really important, because that also guides how we are using the medicines. Are there drugs that are resistant now? We should remove them from our stock, right? And for us to have a meaningful program, you need to have a good interaction between the lab, the pharmacist, and the doctors that are prescribing. Because oftentimes you have a pharmacist that is sitting in the middle of it, who is guiding how the antimicrobial should be prescribed. But the lab is not doing antimicrobial sensitivity pattern based on available antibiotics. So then you always have conflicting information. So if the doctors are going to request for culture sensitivity, they will get a culture sensitivity results. But this is based on the antibiotics that are not available in the hospital, which are not used. Then the entire exercise becomes meaningless. So I think it is important that even the lab, what the lab is doing, should be guided by the pharmacist, should be guided by the molecules that you have. So if you are doing culture sensitivity, it should be based, should be looking for the resistance towards the antibiotics that we have, the drugs that we have available, not some drugs that are not available at that particular setting. So I think this is an important role that should be really played by the pharmacist. And pharmacist sits as a very important place and position to spearhead this important initiative. I mean, we are also looking at the preparation of formulation as well as innovation. And there are times when we might need to repurpose molecules when we don't have them. You see, most of the time as a pediatrician, we always have limitation of pediatric formulations. And once we have limitation of pediatric formulations, then we really need to get somebody who will help us, making sure that these, whatever medicine that we are giving are friendly, you know, and that comes with making them, instructing how to store them, how long should they be used, what is their shelf life like, you know. But at the same time, you also need to be able to improvise. Sometimes we need to improvise. There are times when we don't have molecules. For a long time, we've never had sodium bicarbonate. Sodium bicarbonate is an important drug. We always have injectables, but we don't have oral medications. And we have patients that need to be on sodium bicarbonate for a long time. So one of the innovation is to use baking powder. So if baking powder can be formulated, you could you could make a solution that can be used for the same purpose if you don't have tablets. And at times we've been doing peritoneal dialysis and we don't have PD fluids. So we've been making PD fluids from intravenous fluids. And so this is one area that we need the innovation and support of the pharmacist. The other important area is the repurposing of molecules. You know, we have drugs. Some of these drugs are very expensive. A good example is immunosuppressants. For example, tacrolimus and cyclosporin. These drugs are very, very expensive. There are innovative ways of cutting down the cost. And one way is to use ketoconazole. Ketoconazoles kind of inhibit metabolism of these two drugs. So if you are to give 2 milligrams of tacrolimus, you might give 1 milligram of tacrolimus if you combine that with ketoconazole. And 1 milligram can save cost, right? And so that means you can make a drug which is not affordable to some of the patients by just repurposing and playing around with their pharmacokinetics and pharmacodynamics, which is really, really important. Some of these molecules are very, very expensive and they cannot be affordable to most of our patients. So this is an interesting case that I would like to show you to show what is the role of the pharmacist can play. For a long time, we've been using improvised fluid for peritoneal dialysis for children that have acute renal failure. And we are initially making this one at bedside using normal saline, dextrose, and sodium bicarbonate and all this. But currently, the pharmacy department is making this fluid for us. So every time we need this fluid, we'll request it from the pharmacy and they will have it, they will prepare once we need it. And of course, this is ensuring that it is made under a safe environment, you know, with a good guidance and good storage, which makes life easy for us and limits the contamination, improving the safety of this medication, which is quite important. Another important example is the fact that we've been, the School of Pharmacy, under Professor Kahala, has been able to make hydroxyurea, which have been made locally, and make them available for these patients. Hydroxyurea is one of the essential treatment drug that is required for patients with sickle cell anemia. But this is a very expensive drug. One tablet of 500 milligrams will cost around 1,000 Tanzanian shillings, and these patients will need that for life. So, but also, so the issue was these drugs is inaccessible because it's quite expensive and not everybody can be able to buy it. But also the formulations are also difficult because these are capsules which comes into 500 milligrams. Sometimes you might need to get a smaller weight of 250 milligrams or 200 milligrams daily. So you might have to give, so sometimes instead of giving it daily, you have to calculate a weekly dose and give it Monday, Wednesday, and Friday, because you want to give 1,500 and you cannot give it daily. So you give 3 tablets in a week, which might not give you what you really want from the point of view of the drug availability and therapeutic levels. But this is what you have to go with because of the nature of the formulations that is available. But I think it is also important to look at, if you're looking at the safety of the drugs, I think it is the key role the pharmacist that has to play. How are the drugs stored? How are they transported? Are they maintained under optimal conditions? I often see patients and other colleagues walking around with erythropoietin, which is supposed to be refrigerated. And you'll see these people walking around with this drug for hours, sometimes days, and then eventually these drugs are going to be administered to the patient. So that means you're wasting that drug. The active molecule will not be there if it is not stored under optimal condition. So I think it is really, really important that the pharmacist plays that role of making sure that these medications are really, really properly stored. And some of the medications will require pre-medications, you know, and if they require pre-medications, if you have anticipated adverse reactions, are we all advised that if you're giving Penadu injection, you could get an anaphylaxis reaction, and you always have to have adverse reaction medications in case of an adverse event happening. So we need to make sure that this environment is provided safely for the healthcare providers that are administering these drugs. And this should be driven, should be guided by the pharmacists who are experts in these molecules. Again, another important area is the community. The community plays an important role. And if you're looking at the community, the pharmacist has an important role of educating the community at large. And when you talk about the community, you're talking about everybody, including we all use medicines. These are important molecules that everybody is using. And we have safety issues. We have prescriptions-only drugs. We have over-the-counter dispensing. Are these things being guided? You know, are people self-treating themselves? Do they know? Are we discouraging? Do we need to discourage self-prescriptions? Are we educating the policymakers so that they can advocate for these things? And there are several platforms that can be used. One of them is media, and social media platform also plays an important role. You're talking about Twitter, you're talking about Instagram, Facebook, Pinterest, Snapchat. There are a lot of social media outlets that should be used. Of course, in the past, I used to think that using Twitter and Facebook is a wastage of time. But in the past 4 years, I've seen a president running the country using Twitter. Then I realized that if you are not in Twitter, you have to get your Twitter account so that you might be able to know what is happening. And Twitter has been an important source of information for me. And I've received a lot of information through Twitter from a lot of educators, including pharmacists that have been providing this important information. So I still believe that pharmacists need to be in this social media outlet. And remember that this is one of the important source of misinformation and malinformation as well. There are a lot of people that are using this space and giving a lot of myth and wrong information to patients because they have big audiences, then they get listened to. And so I guess it is our duty to make sure that we occupy this space, we interact with these people, and we have enough audience to communicate the right medication. But it is also important that whenever you're using this platform, we refrain from providing treatment and advice on the Twitter platform and these social media platform. I've seen colleagues prescribing drugs, telling patients, use that drug, that will help. That is quite dangerous and it is not safe for our medication. So I think, but it is important for pharmacists to use this space, because if you don't use this space, other people use this space and create a lot of wrong information. I guess we've been having problems lately because there are a lot of people that are using the platform available to give all the information that might not be accurate and that might be wrong, simply because we've left a vacuum. So I guess we really need to flood all these social media platforms so that the right message can be sent and corrected all the wrong information that is provided. Of course, I believe that pharmacists are playing an important role in whatever institutions that they are working in to improve the performance of the institution. You know that drugs is one of the most utilized commodities in healthcare. So if the pharmacists are able to forecast, and this forecasting is not only for the individual hospital, this might be the entire country. If you're able to procure for a single health center in a district, that means you'll be able to procure for an entire district, and you'll be able to procure for an entire region. And it is important to forecast how much do you use of these drugs, you know, what is the shelf life, you know, and you have to audit how much are they being used. And this includes equipment as well, so that you don't have drugs that are expiring. And of course, also it is important to be able to communicate closely with other regions and facilities. So if you have drugs that are about to run out of shelf life, you should be able to share them with other facilities that are using them, you know. But it is also important to you to advocate for reusability of equipments that we are sometimes throwing away. It is important to have equipment that can sterilize, and sort and handling this. But this calls for good guidelines and SOPs. I'm giving this example because I know MNH is one of the hospitals that have been able to revolutionize the way they are using the drugs and the equipment. Under the pharmacy department, they've been able to audit all the equipments that are being used and the drugs that are being used. And they've really cut down a lot of wastages of drugs and these equipments. Another important role of a pharmacist, as I see, is the fact that they need to play an advocacy and for pharmaceutical services. The pharmaceutical services has a lot of areas that need to be improved. We have molecules that are not available in the country, which are not registered, and they might not be registered at any given time because of their demand and their use and their cost and their the profit margin that comes with those drugs. So these are the drugs, these are the things that might need to be advocated for. And the only way to advocate for this is to be part of the society. And I believe that Tanzania Pharmaceutical Society is one of important society that need to be playing this particular role. Of course, in collaboration with other societies, including all the health professional society. And for us to do that, we need to be able to share information. We need to share the skills. And this sharing of skills should be nationally, regionally, and internationally. And this should be through the conferences that we have, through the workshops that we do. And this is the only way we do. We need to advocate for better legislation, drug policies, drug self-destruction, disposal, marketing. So we can only engage these policymakers meaningful if we work through the society. I always tell my colleagues that if you want to see the permanent secretary today and you tell them that I'm an employee of Temeke Regional Hospital, I want to see you, the permanent secretary will tell you, have you spoken with your hospital director? Because that's the channel. This is the channel. You have to, whatever request you have, it has to be through the hospital director. But if you go to the permanent secretary as a member of Tanzania Pharmaceutical Society, then you have that access to speak with your permanent secretary and air whatever you want to say. So this plays an important role in advocating for the activities. And this one, so when I look at membership of these societies play a key role, okay? And for these societies to do that work, we need to be members of that. So I really think that a pharmacist, and my model for pharmacists will be a member of Tanzania Pharmaceutical Society, will be paying fees, will be participating in the society activities, and through that way, they will be able to linkage and to network with colleagues regionally, locally, and internationally. And they will be bonding with their fellow colleagues. And these fellow colleagues come from different works of pharmacy. Could be academic, could be industry, could be hospital. And this also cuts the bureaucracy, because if you want to speak with the chief pharmacist, you don't need to go to his office. You will speak with him in the conference. And whatever you're discussing with, you'll be able to air your information. And on the same note, I thought it is important for pharmacists to be part of International Pharmaceutical Federation. I'm not sure how many of us in this audience are aware of the International Pharmaceutical Federation and are aware of all the good activities that these guys are doing. So these are some of the activities that I've been able to see, that are webinars, these are conferences and learning activities that are happening throughout the year. And these are important activities that will give us experience and will give us an opportunity to see what the pharmacists are doing globally, okay? So that we can improve our services and make sure that we better whatever practices that we have and the healthcare environment that we have. And these they could also be an opportunity to learn what avenues are there for developing different things of different interests. Can we think of small industries? Can we think of manufacturing things locally? And these are the areas these are the platforms that can give us these ideas from different people that have done a lot of things. So, and I think it is important, the professional societies are playing a very, very important role. And they can regulate the practice, they can improve the awareness and legislation, they can identify opportunities, different opportunities, which might be for capacity building. They can address other issues of public health interest, including availability of molecules, the production of molecules locally, repurposing of drugs, availability of orphan drugs, and all these policies. And just to show you the role and the power of these societies, I'm just showing you what the Emergency Medicine Association of Tanzania has been able to do. They are the registered center for providing basic life support in Tanzania. Okay, and they've been able to establish emergency medicine department in Mbeya region, and now they are moving to other regions. And of course, they are doing this collaboratively with the Ministry of Health. And this is showing you that the society like Tanzania Pharmaceutical Society has a lot of influence, and it has a lot of mandate to improve the services that are happening in the country. Another important example of what these societies are doing, this is the Muhimbili National Hospital, and this is pediatric complex. This building was built initially by Pediatric Association of Tanzania. They built it from ground, and they thought that the children were not getting the best services that they required, and they thought that they can't start. They started collecting money, and they started building it, but then they could not finish it. Then eventually the government took over and finished the building. So I'm just showing you, to show you the power that Tanzania Pharmaceutical Society has and the influence that it can wield to make sure that you're improving the environment for the practice of pharmacy in Tanzania. And that which shows the role of a pharmacist beyond one particular institution, beyond one particular small area, and just improving the national framework for providing pharmaceutical services, as well as the global framework for that matter. So I guess this is what I've prepared, and I believe I've been able to show you that a pharmacist, from my point of view, is a key player in healthcare setting. And I think for a pharmacist to be able to do this work, they need to be thinking, they need to interact and collaborate and think like a surgeon, and think like a pediatrician, and think like a nurse, for them to be able to work collaboratively and work with them. Because if a surgeons need drugs, they need antibiotics, you need to think like them, and you need to sit in their shoes, so that you unless you think like a surgeon, you will not be able to see eye to eye with them. So I think that's an important role, that's an important aspect and skill the pharmacists need to be able to have. And I believe that you're doing great job so far. But if you are able to do that, you really need to come into our mind. What is this pediatrician thinking about? Why is he prescribing these kind of molecules? And for how long are they going to prescribe these molecules for? Then if you are thinking in that way, you'll be able to help them and better the environment that's available. And ultimately, we'll be able to improve the health of Tanzania and the globe at large. Thank you very much for your attention.
Okay, thank you very much, Dr. Francis, for a very good, insightful, and informative presentation. We have spared at least 30 minutes for question, answers, and discussions. I believe the audience will have some questions, and they are welcome. Anyone with a question to straightforward, unmute yourself and ask. Welcome. Maybe I will break the ice, and I have a question on your day-to-day practice. How much do you think the medical doctors are likely to agree to the advice from the pharmacist, especially in the clinical environment. Like when the pharmacist has corrected your prescription, has proposed an alternative drug, what is the likelihood that you will agree, and other colleagues as well?
Yes. So this comes into two forms, and you know, let's look at it in this point of view. We are all serving the patient, and whenever I get informed, that this drug, this is how this drug should be given. This information is given in the interest of serving these patients' care. So I believe we are all likely to change, and there could be difficulties. And I'm not saying that it is going to be that easy, because we have a culture. These things are driven by the culture. Somebody has a culture of just writing medications and sending it to somebody who's going to dispense without looking at what has been given, which is really not safe for the patients. So, but eventually, once we get to know each other, you know, I know that I'm talking to Nelson, and Nelson is talking to Francis, and it might not be writing in the file. It's calling Nelson and calling Francis, you know, sorry, you have prescribed this one, but this is not the dosage. You know, we don't have these drugs in this formulation. These are no longer available. So these are the kind of information that have to come. I've worked in South Africa at Red Cross Children's Hospital. All our prescriptions used to go through the pharmacist for the patients that are admitted in the ward. And the pharmacist will sign that this dose is correct. And whenever you write a funny dose, you know, a funny dose, there are times when we're giving, for example, we're giving albendazole, 400 milligram TDS for 7 days. And the pharmacist will come and say, you know what? Why are you giving this medicine like this? So we had to justify to them that we are giving this one because we are worried that this particular patient is kidney transplanted patients, and we think they have worm infestations that might cause problem to the graft. And this is why we are giving this drug. And if they are satisfied, they will give us the drug. And sometimes they'll say, you know what, you have written these drugs, but this drug has to be signed by the consultant. I'm not happy with this dose. So this is the nature and the setting. If the setting is right, and we all know what we are doing, and we are doing it in the interest of serving the patients, we are not doing it to embarrass anyone. And it's not like we are saying that you are an idiot. No, we're just saying that it is not safe to give this particular person this particular dose. Did you see that example that I gave you of a 3 years old child who need treatment for anemia? So if somebody writes that anemia, if somebody writes that prescription for 3 weeks, you're not treating this anemia. So if somebody is correcting us, I think we should be open to listen to that. And I think that comes with the fact that if a pharmacist is known as a source of information, and you have to make sure that you are available and you communicate, you interact, and you have to know these people. And knowing them is interacting with them, communicating with them, even chatting over tea and coffee. And once you know each other, then you can easily communicate and change these things. But I want to believe that everybody should be able to change. And if need be, we need to have regulations and guidelines that are guiding how we give treatment.
Okay, thank you very much. Is there any other question before I start reading? You can also type your question directly in the chat box. I will read it for you. Okay, meanwhile, we have a question from Nazia Laha, and she's saying, sorry, doctor, in South Africa, you may have noted the use of health passports, which has details of everything, and also the use of barcoding for repeat prescriptions. I was wondering if there would ever be a time such a system can be employed in Tanzania. So what is your comment on that? Welcome.
Thank you so much. I think that's a very good observation. So I'm just thinking out loud, who is supposed to advocate for these things? Because I mean, I certainly, when we want to change the way things are done in any country, we always look up at the minister. You know, the Minister of Health is not an expert in pharmaceutical services. If you look at the permanent secretary, he's not an expert in pharmaceutical services. Who are these experts? The pharmacists are the experts. They know what is better. But then we need to engage these people that are making decisions. So I want to believe that these are important aspects that need to be observed. And of course, it's not only these kind of barcoding and having these, the technology can allow us to use this, but then we need to have advocacy, and this advocacy should be driven by experts, and these are the professionals themselves. And I guess this is why I'm trying to say Tanzania Pharmaceutical Society has an important role and sits at a very good position to promote as well as to advocate for these important innovations in improving the safety of medication in Tanzania. So yes, I think that day will come, but all of us need to make sure that we start working on that day for it to happen. And I want to believe the pharmacist has a central role in that. And Tanzania Pharmaceutical Society will be a really good platform to channel these kind of ideas.
Okay, thank you very much. I've got another question from Elia Martin, and he's saying that he has 3 questions in one. And say, can you give your insights regarding the role of pharmacists in traditional medicines? And 2, do you think traditional medicines should be given same weight as modern medicines? And 3, are you seeing traditional medicines pharmacies supervised by pharmacists in the future? Thank you.
I did not get the second part of the question.
The second, you say, do you think traditional medicines should be given the same weight as the modern medicines?
Well, first of all, there was an issue of role of pharmacy in the traditional medicine. Yes. Was that the question?
Yes, that's the first one.
All right. So, well, I think there are 2 ways of looking at it. Most of the drugs that we are using, most of the molecules that we are using are developed from plant extracts. Some of them will be animal extracts and some other forms of chemicals that are extracted from these natural things. And I want to believe that the pharmacists are the experts in extracting the active substances that are in drugs. I believe that there are drugs that have been used for a very long time in this country by traditional medicine that have been used locally for treating pain, for treating convulsions, and for treating that. So the role that I see is trying to understand what are the active ingredients in these compounds and these molecules that are being used. And is it possible, if they are really useful and molecules and compounds, can they really purified and be made into form of medicine that can be used? So I think that's the role that I see, that they could be an innovations in this form of drug discoveries through whatever is being used as traditional therapies. There might be a lot of molecules, a lot of plants that have medicinal effect that can be extracted and used in a formal way. So that's one area that I see. But the other thing is, when you look at the traditional medicine, I think can be looked as a specialty on its own. It's a different discipline, and it depends. If you really understand how it works, you might be able to say what happens. But what I see the role of a pharmacist and any other healthcare provider is to understand how is it offered, how is it offered, and what are the driving force? Why are these people using these kind of ways of treatment, and how are they working? I can assure you, sometimes it is just placebo effect that is making people feel safe. I've been able, you can treat somebody using water. If they come to you and tell you that they have severe headache, you tell them, take this glass of water, and you don't tell them this is water, you tell them this is a very strong medicine that I have here. So you could have psychological affect people and to feel better. So sometimes that could be the effect that is bringing about the response that we are always seeing in some of these patients. So I think the role of pharmacists and any healthcare provider is to understand, first of all, what are the driving forces for these kind of services to happen. But then to see what role do we have, okay? Are these services safe for our patients? Because if you have a patient with breast cancer going to the traditional to traditional services and then coming back late to you, and you are giving chemotherapy which is not going to cure the patient, then there's some problem there. And if you understand better, then you will be able to serve the purpose of these patients, and of course serve the purpose of these people that are practicing the kind of services. So I guess one role is to understand what is going on, and then use that as an advantage to better the services that we have, use the molecules that they have to discover new drugs if we can. This is what I see.
Okay, thank you very much. Back to the audience. If you have a question you would like to air it, you can unmute yourself and ask it directly, or you can type it on the text box, chat box. Welcome. Okay, while they are still coming, I have another question from Samuel, and he's saying, hello, doctor. We have noticed currently the rapidly adjustment of various antibiotics for the management of rapid or uprising diseases. For example, currently we have azithromycin for COVID, ivermectin for COVID. What is your take or anticipation regarding the uses and the drug in the near future?
Yes, thank you very much. I think, so I will say, one thing that I will say is, if you look at the pharmacy practice in Tanzania, I will tell you that it is unique. It is unique in the sense that the structure and the framework that is available in Tanzania is completely different from what is available in Kenya and what is available in Canada and Australia. So, and the way the other colleagues address different problems are based on their setting and their circumstances and what is available in their setting. So one of the challenges that we do face is the fact that we usually copy and paste what is done in other settings. So this has been one of the flaws in our practice. And I would like to respond in two ways. First of all, we always have, we need to strive to generate our own data. Okay, we need to strive to generate our own data. Because if these drugs were shown to work in America and in India, that does not necessarily mean that they will work in Tanzania. So that's one thing that we need to look at. And so we need to generate our own experience, and we need to audit it and see, is it working or is it not working? So the onus is upon all of us as pharmacists, as clinicians, as other healthcare providers. We need to sit down and ask ourselves, why are we giving these drugs? How are they working? And how did it work? What is the outcome of these patients? Of course, one of the challenges is the fact that you also need to be given space to analyze the data that you have. But even when we are given space to analyze our data, we are not documenting what we have. That's why if I ask you today, what are the adverse events? What are the adverse reactions of different molecules that are used in Tanzania? Nobody can tell me that. We don't have that. But you will say that, okay, it is reported in Australia, this how much they get skin conditions. But that is not in Tanzania. So I think it is important for all of us to start generating information and to audit what we are doing. So including those who are working in pharmacy stores, they need to make sure that they document how many patients are getting which reactions. And for these drugs, the drugs that we are using now, of course, this is a very dangerous trend if you are not careful to make sure that they are being used safely, because everybody is being given these drugs and people are buying them in the pharmacy, even when they are not sick. And some of them are stocking them, keeping them for future use, which is not safe. And I am not sure if all of them work. So you will see azithromycin, some will say augmentin, some will say give these drugs. We might not have strong scientific standing to discourage or to promote their use, unless we sit back and look at the evidence that has been generated locally. So I mean, the message that I'm trying to put across is the fact that we need to be aggressive in generating our own data and auditing what we are doing with whatever outbreak that we get. Any outbreak that we get and any disease that we get, the response will be different. And we need to make sure that we use these drugs and document our experience so that we can use that experience and say, you know what, if we use this drug for 2 days, it works. We don't need to give it for 5 days. Thank you.
Okay, thank you. We have about 10 minutes left and we have 4 questions. I hope we are going to answer these 4 and we'll be winding up. So the first one is from Gladys Yona and say, Doctor, the fact that pharmacists are somehow need during patient consultation or ward round is so true. But with our current settings, there are never enough, meaning the pharmacists are never enough. And the feedback system from the dispensing outlets to the prescriber is not always feasible or may delay services. What is your advice on this?
Yes, I think that's a very good observation from Gladys, and I think that is completely true. And the reasons are twofold. It could be partly because the doctors are not ignorant. I'm saying are ignorant of the services that can be offered by the pharmacist, but also it is also true because the pharmacist might be a little bit timid that they don't realize their role in making sure that the patient's safety is observed. And this comes with the fact that developing therapeutic committees that are guiding how molecules are being used in the hospital. And I think it calls all of us, and pharmacists are few, yes. If there are few, then we need to have a way which is safe of making sure how things are given safely. And we need to be innovative for us to be able to use that space and to provide the safe standard of care.
Okay, thank you very much. Another comment from Fadhili Hezekiah is saying, I really enjoyed the presentation and discussion. The gap I am seeing is on communication skills and in some cases, lack of continuous education to adapt the change and the speed we are in. So that is a comment. And a question from Amasha Kigosi saying, in nephrology aspects, there are so many dosage adjustments which could be new to pharmacists. Is there any possibility for the pharmacist to specialize in nephrology?
Well, that's an interesting question, literally. And to answer that particular question, I mean, it goes back to Tanzania Pharmaceutical Society and the pharmacists at large. What are they thinking? Are there things that we need to do? And actually, that's absolutely true because we change the medications every single time. And once we change the medications, we always get a problem from the other side. The reason is we are getting problem because the other side might not be able to understand what is it that we are doing. So for a nephrologist to be able to provide safe practice, they need to have a pharmacist that is thinking in the same way. If you're not thinking in the same line like me, we are not going to provide the same kind of treatment because we are saying that this particular patient requires cyclosporine, which is very expensive for them. They cannot afford. So we are giving ketoconazole and cyclosporine together to reduce the dose, to reduce the metabolism of cyclosporine. So the pharmacists need to be thinking the same way I'm thinking so that they can give these drugs. If they are not going to do that. So I guess one of the biggest problems is the fact that sometimes the pharmacists are not thinking in the perspective of the nephrologist. And sometimes the nephrologist is not thinking in the perspective of the pharmacist in terms of availability. Because I'm a nephrologist. I want my patient to get 3 months supply of the drugs because I believe it can be done. But I do not understand that you have problems in your procurement, in your supplies. So if we all understand and share the problems and the challenges that what we want to achieve, we'll be able to plan better. So I guess that's what I look at. I look at the pharmacist need to be able to think like a nephrologist. You have to. If you are not thinking like a nephrologist, you cannot provide these services.
Okay, thank you very much for good answer. The last question is similar to that. I believe you have already answered it, but I will read it. Nevertheless, it is saying, what is your opinion on pharmacists taking specialized courses, say pediatric pharmacist, endocrinology pharmacy, as a way of being equipped to better work in a specialized team to care for a patient? So I believe this was answered in the
Maybe I could
previous.
just respond shortly for that. I think it is an innovative way of doing things, and when you are looking at it, actually there are a lot of things that comes with it. Because I look at the drug levels. We are not doing drug levels in Tanzania. You know, things like vancomycin need drug level, gentamicin need drug levels, and all this. And these are basically the pharmacist's role. These are the pharmacist's role, because he's the person that can interrupt, can interpret what levels you get. But we often send this work to the lab technicians who are not experts in pharmacodynamics and pharmacokinetics, and they give you results that they do not understand what it is. So I think it is important that pharmacists need to identify and to think of roles that they could do to better and to make the practice of and the utilization of pharmaceutical molecules safe.
Okay, thank you very much. Back to the audience, if there is anyone who would like to ask one last question, you can turn your mic on and ask.
Hi, I hope you can hear me. This is Eliford Kitabi. I would like to talk on the role of pharmacists in traditional medicine, and I want to contribute to this because it looks like traditional medicine has been given a big push by the government of Tanzania, and pharmacists have an important role to play, and it's an important scientific and professional role of the pharmacist with regard to traditional medicine. Traditional medicine can be operated scientifically by standardizing them, and that is one of the role that the pharmacist can play. Other than extracting molecules, active ingredients from the traditional medicine, they can be standardized. And when I say standardization, is making sure there are fingerprints in the traditional medicine that can talk or can give an insight about the quality of the traditional medicine and about the consistency of efficacy of traditional medicine. And when they're standardized in this way, the pharmacist can further play a role in working with the clinician to perform clinical trials of this traditional medicine to make sure their claimed activity or their claimed cure of diseases is scientifically based, or there is evidence, scientific evidence to show that this traditional medicine will work. And this is the role that the pharmacist can play in designing the clinical trials together with the clinician, and also supervising collection of data to prove that those traditional medicine will work. So pharmacists, I think, have an important role to play in ensuring that traditional medicine that are being advocated by the government of Tanzania will help the Tanzanian and can provide a source of income for the pharmacists, for some of the pharmacists who would like to take an entrepreneurial role in mass production of traditional medicines for sale in the country and for the sale out of the country, just like how China is doing it. Thank you.
Yes, thank you very much, Dr. Elford Kitabi, for such a nice contribution. And I believe we have now come to the end of our presentation. I would like to thank you, Dr. Francis Furia, once again for taking your time and presenting this very insightful topic for us. I believe everyone has got something new, which will ultimately improve our day-to-day practice wherever we practice in different areas of pharmacy. I would also like to thank the audience for joining today's presentation. We apologize for starting about 15 minutes late. And also we apologize for those who could not join because they could not see the confirmation email in there when they registered. So we are working sure to make that there is not so many steps when someone registered. There should be no confirmation also, so that the things can be more straightforward. We are looking forward to have another presentation next month, and I hope to see you all again. Thank you very much for your participation. And with that, I would like to end the meeting for all. So thank you and goodbye for today.
Thank you, sir.
Bye.
Bye.